Hi, Pastor Chris here. Just wanted to go over some of the things that I look at when trying to figure out as far as the risk of COVID-19 in our community. This is a site that I look at every day. It comes up, type in healthynebraska.org up in the left hand. It defaults to Lancaster County. In order to check Kearney County, you scroll down here on the right. And I did something on there. Up, get rid of that, and then go to Kearney County. So I get that. We'll come up there. And so that specifically tells us what the numbers are for Kearney County. So I look at this black line, which is a 7th-day average of new COVID cases per 100,000. Obviously, you don't have 100,000 people by any stretch of the imagination in Kearney County. So it's really somewhat misleading, but this is what it would be if we did have that many people in the percentages. And so that's a black line. You'll notice that as of July 31st, the 7-day moving average was 17.46. The testing came in from yesterday. It's not factored into the average yet, but we had 3 new cases yesterday, which is that tall bar there. Because it is a relatively small sample size, and a lot of our folks also work other places, I like to include different counties as well. I know we have folks that work in Phelps County, so I'll add that as well. And I know we have folks that work in Buffalo County, and we've got folks that work in Adams County. Okay. And so there you have the same numbers for those 4 areas. It's a larger statistical view of what's going on. As I see now that still in these areas where most of our folks work, it's still the rate per 7-day moving average is a little bit lower than just Kearney County, but still substantial, 12.86. You'll see these color grids, the green, yellow, orange, and red don't really mean much. These are the zones that University of Nebraska Medical Center would suggest restrictions and stuff come into place. So they have a relatively low bar set of 5 cases per 100,000. That's when you really have some pretty major lockdowns and that kind of stuff. And I don't think that's realistic. The Harvard model, which I will show you here. This is from the Harvard Global Initiative, Health Initiative. You see there in Nebraska. Once again, these color codes are sort of weird. Here we have 2 areas of red. Well, this area of red is Wheeler County. So there's only 2 cases, but because it's so sparsely populated, percentage of population, it's huge, which is not sure that should be red. And so we do have a little bit of flexibility just because of the case there. But I wanted to show you is at the bottom here. It talks about the different categories here, and that's what this is a less stringent kind of thing. The green area, monitor of testing and contact tracing for cases less than 1 case per 100,000. Right now in our community, it's limited to 6 tests per day, so that there was reagents to do the active testing is really down low. There's some antibody testing that could perhaps be used in conjunction with others, coming out more test kits soon. Community spread, rigorous test and trace programs advised. And so with the 1 to 9 cases per 100,000 people, right now Kearney County's in this area 10 to 24 cases per 100,000. And so there the suggestion is stay-at-home orders and or rigorous test and trace programs advised. Well, we really can't have rigorous test and trace programs right now as a county, simply because there isn't the ability to test. The Test Nebraska tests have been coming back way delayed and that kind of stuff. And we're really not going to do stay-at-home orders on a community level. That's just not how we're wired here. And that is why when things get to be above 10 cases per 24, that's really my cue to sort of dial back. And so I won't do visits indoors. I will not go shopping in town in any kind of facility unless I absolutely need to. And even then, as of now already, I don't go in places where there aren't personal protective equipment, that kind of stuff. So that's when I gear back. And my suggestion is that once we get to that 10 to 24 cases per 100,000 people is when we make the decision of a church that, okay, we're not going to have anything other than worship. If it's above that, perhaps worship with more strict requirements, more, hey, masks are very, very, very important, and we're definitely going to keep our distance more and that kind of stuff, hand washing more. The orange is getting serious kind of thing. And so I'm comfortable with that just because we are sparsely populated. But that's why I think that 10 per 100,000 Kearney County specific, and let me just show you that again, what that looks like here. And so get rid of Phelps. Okay, so there we have just Kearney County specific. So the only time that we've crossed that 10 limit per threshold was just this past week. So by and large, we've been really quite COVID-free. Right now, 8 active cases diagnosed the last 5 days. Statistically, it's pretty impressive, but since it's really not much. Now, that being said, since there's not widespread testing, a lot of people are asymptomatic. A lot of the epidemiologists would think that might be 10 times that amount. So perhaps if there's 8 diagnosed, we're talking about 80 community cases in total is what they're thinking based upon what the testing's been in other places that they've been able to do after the fact. So I showed you the Harvard site in for these colors, but as far as the map goes, you could take it or leave it. It's perhaps a little bit better, large geopolitical nation stuff. I also check every day Two Rivers Public Health Department. And here it automatically pop up to Dawson County, updated July 21st. Every Saturday it's supposed to update. But going to the main dash are the numbers that are current for the day. And so this is the most up-to-date stats as far as that goes. Oh, back to main dash. Where's main dash? There it is. Okay. And so you can see, however, on Kearney County, 23 cases right now total. This is the number of tests they've done versus number of tests positive. So you see the positive test, more and more tests are coming back positive, even though fewer are given. And that's done by a week statistic there. So this is where you get numbers from. But I also look down here at the new cases of COVID-19 reported. So I check down here and I'm like, oh, this is where we see that Kearney County's had 3. And you can go back with the last week of numbers, which is can add to there. And so it's before it gives a 7-day average of cases per 100,000. Looking there, it's like, okay, tomorrow I know that number is going to go up. And so we can able to make some decisions there. So I get a lot of my information from several sources. One is this is a CIDRAP, Center for Infectious Disease Research and Policy. And the guy who is the bigwig there is a guy named Michael Osterholm. And these podcasts are excellent. They're about an hour. Just question and answer and talk about all things about school opening, a global approach and what can be done. Just very, very helpful. I find them very helpful. And so he was really been at the forefront of other pandemics that the world has faced, Zika and the first SARS epidemic. We're in the second SARS epidemic now, Ebola and some of these other things. He's been one of the go-to people in the world. So he's there, but this is scholarly articles that are accessible. If you want to get deep in the scholasticism, you can, but I find this really good. So what he's saying now is that probably the contact isn't as big of a deal So if it's more of the aerosol, so if someone sneezes or breathes with the COVID and you walk through that breath, you walk through that sneeze, you're much more likely to get infected than someone sneeze on a thing in the grocery store. You pick it up and then, you rub your mouth. It's just not how it gets in the body, it seems, from what they can tell by the studies that have been done. So I'm a lot less concerned about hand washing, though hand washing is always good, but that's not the solution. The solution is to keep those sprays and those aerosols down. That's why we follow the state's guidelines as far as having the windows open in church and the fans going, keeping ventilation going. Parts of our building we don't have a way to get outside air to, such as the basement for Sunday school classrooms. The fellowship hall just recirculates the air that's already inside, and so that gets to be a little bit more problematic as far as keeping the spread down. Good source of information there. Showed you the press release from Two Rivers. This is from the University of Nebraska Medical Center. And they do a slightly different set of data that is through the state, and which is a little bit less accurate than the set of data that the Nebraska County COVID that this site uses, the healthynebraska.org. It's politics are involved, but this is compiled by reporters that look at each individual county information every day, enter it in, and so this Tableau Public is a better database than, as I understand it, than what the UNMC, but this also works out well. So, all sorts of really interesting information there as far as social vulnerabilities, it gives population density over 100. So right here you can see, let me see if I can make that larger there. There we are in Kearney County. Relatively, we are good. We're not in the deep red, meaning that we've got a relatively good overall social vulnerability index. We don't have many people without health insurance. We, things are well-rounded, relatively speaking. Don't have a lot of population density, and so those are all things that bide very well for us. That being said, we do have a population over 60 by and large, and so let me get this a little bit brighter here. So, and these are even broken down by these blocks here. So there's the city of Kearney. Here we are in Minden, and so we have a lot of folks over 60 that live in our area. I mean, it's all rural. Even in town, they got two separate wards there. So it's a little bit different, but that's one of the things that could potentially be a hindrance there. So like looking at the UNMC stuff, also like following Dr. Ali Khan, who really was groundbreaking with the first SARS epidemic. I've read Dr. Osterholm's and Dr. Khan's audiobooks, or listened to audiobooks anyway. Very interesting reads, and they're both medical detectives trying to figure out where it comes from, where it's going, the best way, and they both will say, isolate those who are infected, do the contact tracing, and do the testing and that kind of stuff. So I really feel that as a congregation, I think that we can be nimble, meaning that if we check this chart regularly, we can do this with a fairly good degree of certainty that things will be okay. So even when we had these slight bumps in the past, it did not spread to become a major thing in Minden. And yes, people have been sick, and a friend of mine in Kearney, city of Kearney, had it and was recovered well. So I do know people that have been touched this area, and I'm sure that some of you do as well. But I really think that once we get past this 10 cases per 100,000, that would be the trigger. That would be okay. This is when we're going to do things differently. For my personal family, I know when it gets above the 10 per 100,000, that's the cue that my kids are going to stay home from school, just because that's what the epidemiologist would suggest is a time for lockdowns. Well, if the community's not going to lock down, by golly, I can keep my family from getting it and spreading it to others. I'm really not concerned about negative health consequences for me or my family. Yes, I don't want to get sick, but more concerned about me picking it up, not realizing I'm picking it up, and then I go visit someone who is frail, someone in the hospital, someone who might be more vulnerable, and do a funeral or something like that, where it's spread to others. So my concern for my family not getting is that it doesn't give it to me, so we don't give it to others. Andrea, working for BD, also want to make sure that the BD facility stays safe. They are working with syringes for vaccination there, so that facility is vital to our pandemic relief efforts in the country. So we really want to make sure that we stay safe. The guidelines have been pretty consistent. From the whitehouse.gov or for Two Rivers Health Department, and it's all been, you want to make sure that you wash your hands, wear cloth face coverings if you're going to be within 6 feet of people, particularly if you're indoors. I like that "Keep Nebraska Flat." That's and a picture of me there in the center with the red hair and the beard, which is what I used to look like. So we want to keep Nebraska flat, but I think we can be pretty nimble. There's really no reason to close down for months at a time if there's just no cases. That being said, we do want to close down as soon as the cases start to spike, start to rise, because that's when it really makes a difference. And there's other things as well. If everything's contained like Mosaic or something, or Bethany Home, heaven forbid, but that means that it's not in the general public as much, and that might make a difference too. So that's what I'm thinking there. So I'm not. I think the community will do the best when we keep as much normalcy as possible, but that's also being flexible. It's like actually checking, just like we check the weather. Hey, what's the weather going to do today? It's going to be, hey, checking the COVID-19 rate and say, hey, what's the rate doing today? And as more testing becomes available, as it will probably end of September, October, Kearney County Health Services should, as I understand it, be able to do whatever it is that we would need to have done to keep our community safe. I think we're really set better than a lot of other areas in the region. So that's my 2 cents where I get where it comes from. I've done a lot of study, a lot of education, just because if I feel anxious about something, I find that the more facts that I have and the more I can process that, it relieves my anxiety. Sort of like if you go to the doctor and you don't quite know what's going on medically. Well, once you know exactly, the doctor explains it in common terms, like, oh, okay, and your anxiety level goes down. And yes, it's still bad, but you're able to navigate things. We do have a God that loves us, and we do have a God that cares for us, and this is something that is. We'll do the best that we can. We'll do things with grace. We'll look out to make sure our neighbors are not depressed, and look out for our younger neighbors. But until this thing either fizzles out on its own, which could happen 6 months, a year, if it's anything like the first SARS, maybe even longer than that. It could mutate into something worse. We just don't know. This is a really weird virus, as I understand it. I do participate in the community phone calls every Monday afternoon, as I know some of you do, and try to communicate that through our Facebook page, what's actually going on. I think, just like anything else, if you know what the risk is, you can plan accordingly. So if it's not going to rain, you don't bring an umbrella. If it is going to rain, you bring your frog tog or an umbrella, and just know that those are the extra protection steps that need to take place. And this is the same thing too with the COVID-19. So if you have any questions, or if you want to pick my brain, I'd be happy to do so. Had conversation just yesterday with Dr. Althouse about all this stuff, and so I know where Kearney County Health Services stand, and they do their video updates as well. So I invite you to check those out. But if we just, look out for each other and not be stupid, this will go much better for us. And I pray that by God's grace, that's what's happened. So God's blessings, and I hope that your weekend goes well.